The coronavirus pandemic has affected our lives, our economy, our health, and nearly every corner of the globe. The rapid spread of new variants offers clues to how SARS-CoV-19 is adapting and how the pandemic will play out over the next several months. WHO said the highly mutated Omicron variant of the COVID-19 pandemic could change the course of the pandemic. Due to lockdown and work from home culture, people's lifestyles are already severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. Joining us on the show today we have Dr. Raj Santan, MD Internal Medicine, Consultant Physician and Diabetologist, Leela Specialty Hospital, Chennai, Dr. Sadana, DM FSCAI FESC Associate Director Department of Cardiology, Max Super Speciality Hospital, Dehradun, and Dr. Sandeep Suri, MD Medicine, FIDM, CCE BDM, CCTDM, CCRDM, Consultant Physician and Diabetologist, Holy Help Hospital, Hisar. Thank you so much, doctors, for joining us today. I would like to start with you here, Dr. Suri. Some people are already suffering from the long COVID effect. How much are these people susceptible to Omicron? What extra care should people, with comorbid conditions be taking at this point?
See, you cannot stop Omicron. Omicron is a very different virus in comparison to COVID-19 Delta virus, which is still there. Delta is still there, don't forget. But this Omicron is a totally mutated virus, and mutation is in sense that it has lost its S protein. And by S protein, that it has got lesser, around 70 times lesser propensity towards your lungs, towards your pulmonary mucosa. So it will involve lungs lesser. So lesser requirement of oxygen will be there and lesser severe cases will be there. But it has increased its transmissibility by 70 times again. Now 70 times transmissibility increase means that it will spread like fire in the forest fire. It will spread like anything. So most vulnerable patients are those who are not vaccinated, who are immunocompromised. Also, then comes those who are partially vaccinated, then comes who are totally vaccinated, that means 2 doses, and then comes who have got 3 doses. But importantly, if you have got COVID and then you got vaccinated, then you are somewhat more protected also. But those patients who are having long COVID, they are already vulnerable patients, maybe having diabetes, maybe having obesity, maybe having hypertension. So such type of patient should be under strict vigilance, and if develop any issues related to respiratory problems or there is furthermore progression of sickness, they should definitely be asked to their doctor or healthcare physicians for their admissions or other further treatment.
Dr. Santan, all variants of COVID-19, including the Delta variant that is dominant worldwide, can cause severe disease or death. Which organs of the body will get severely affected by this new variant Omicron? Can you just throw some light on that, please?
Just like the SARS-CoV-2 variant and the Delta variant, Omicron variant can cause severe involvement of the respiratory system. In the respiratory system, there can be COVID pneumonia, and the COVID pneumonia progresses, leading on to respiratory failure. Other organ systems that can be involved are the central nervous system, wherein patients can develop brain stroke, or the cardiovascular system, patients can develop heart attacks. We have seen heart attacks and strokes due to COVID in the previous year. Other involvement are the thrombotic events, wherein the patients can develop blood clot in their limbs. It can be due to the blood vessel clot in the hand or in the feet and leading on to gangrene. So these are the complications that can occur due to that is possible with the Omicron variant. Still, the Omicron variant has not been studied completely, and we don't know the exact complications that can occur. But what we have seen in the past, is likely to occur with the Omicron variant also, and that is how we are predicting these are the complications that can occur with the Omicron variant.
Dr. Sadana, what are some of the symptoms of the Omicron variant of COVID-19? Are the symptoms same for people with heart disease as well?
As such, Omicron has affected as a very mild symptoms. They usually present with fatigue or atypical symptoms. The clear-cut data that how it affects the cardiovascular system is not very well known, but as we have seen in the early COVID variants, it might affect the cardiovascular system, and as Dr. Santana has already said, patient can have arrhythmias, that is rhythm problem, can have more heart attacks, or can have a very severe complication that has been seen in other variants also, that is formation of clots in the leg veins, which leads to pulmonary embolism. That is embolism of that clot to the lung arteries, which can be fatal.
Okay.
Yeah. These are the various effects we can see in the patients who have underlying cardiovascular problems.
Okay. So, Dr. Suri, looking at the increasing number of people with diabetes, should blood glucose checks be made mandatory? Should blood glucose be tested in all patients who are hospitalized? And should it be considered as a fifth vital sign that needs monitoring? What are your thoughts on that?
Yes, we should definitely have that blood sugars as a fifth vital sign for testing. That the vital signs most of the time we use, like blood pressure, temperature, pulse and respiratory rate. These are four important vital signs in each and every patient who comes to us. But now we are advocating specifically our initiative from RSSDI, that Research Society of Study of Diabetes in India. We have taken this initiative that let's put blood sugar as a fifth vital sign that should be included in each and every patient who comes to us in our OPD or in our hospital for any other illness also. So we go by two type of pattern. One is opportunistic screening, that patient comes to you with other issues not related to diabetes, maybe fever, maybe gastroenteritis, maybe liver disease or maybe respiratory disease, and you check the blood sugar along with other investigations. But then we also go with the risk factor profile, and that is known as screening type of blood sugar testing that takes care of those patients who are at high risk, even age less than 30, if they have got family history positive, if they have got central obesity, if they have got issues related to insulin resistance, if they are hypertensive, then they should go for blood sugar testing, and that is very important. And opportunistic screening, we take age more than 30, but initially it was around 45, but now we take it up to 30 because more and more increasing incidence of diabetes is coming up.
Dr. Santan, there are some misconceptions regarding the levels of blood sugars that can diagnose diabetes. Which parameters need to be checked before confirming that a person has diabetes?
There are three important parameters that help us in diagnosing diabetes mellitus. First is the fasting plasma glucose levels. When the fasting plasma glucose level is more than or equal to 126 mg per deciliter, it is diagnostic of diabetes. Then comes the random blood sugar levels. If the random blood sugar level is more than or equal to 200 mg per deciliter, it is again diagnostic of diabetes. And third one is the HbA1c, glycosylated hemoglobin. That is the average of the sugars of the last 3 months. And this HbA1c level should normally be less than 5.7%. If it is in 5.7 to 6.4%, it is pre-diabetes, that is the stage before diabetes. And when it touches 6.5, it is diagnostic of diabetes. And this is a very sensitive marker and helps us in diagnosing cases which are in the borderline. So these are the three parameters that help us in diagnosing type 2 diabetes mellitus.
Dr. Sadana, many scientific studies have shown a close relationship between cardiovascular disease and cholesterol levels. Should one focus on lowering dietary cholesterol or saturated fat? Because many times there's a lot of confusion on what to control.
Actually, the thing is, previously there was a concept that dietary cholesterol should be reduced. But now recently, by a lot of trials and a lot of large-scale studies have shown that dietary cholesterol has no linear relationship with the blood cholesterol. But we have to be very specific. Patients who are having already high cholesterol, they should reduce their dietary cholesterol also, and specifically the saturated fats that is present in a lot of like cookies or pastries or other fast foods, and trans fat that is present in a lot of the processed foods. These saturated fats and trans fats should be avoided at any cost.
Okay, avoid trans fats, saturated fats, and of course keep a check on all the levels. On that note, we are going to be taking a short note. We'll be right back very soon. Welcome back. You're watching Beat Diabetes, Myths versus Facts. Starting with you here, Dr. Suri, self-monitoring of blood glucose is essential, for people with diabetes to maintain tight control over their sugar levels. Their use, importance and frequency are different in type 1 and type 2 diabetes. Can you please explain the differences between the monitoring requirements in these both types of diabetes?
Yes, monitoring is a very essential and integral part of diabetes management. If you don't measure, if you don't monitor, if you don't measure, you will not be able to manage it. So it is very important to monitor diabetes. Now, how to monitor it? Most commonly we go with self-monitoring of blood glucose at home. Then when patient comes to the hospital, then it is fasting plasma glucose, postprandial blood sugars and average 3-monthly A1C level. So these are the various modalities which we use commonly. But nowadays we are also using ambulatory glucose profile, continuous glucose monitoring system, and they give us the information around 3 to 4 days and also up to 14 days of whole glycemia pattern of the patient. In type 1 diabetic patients, we have to resort to, you can say it's a more frequent monitoring that is more important. Sometimes 5 points monitoring, sometimes 7 point monitoring, because these are insulopenic type of patients and there is lot of glycemic variability in type 1 diabetic patients. In type 2 diabetic patients, until unless they are under some stress or we are changing medication, infrequent or lesser type monitoring schedule is advocated. But if you monitor it, you will measure it, and then you will be able to manage it properly.
Okay, so monitoring is really key here. Dr. Santan, people who have recently been diagnosed with diabetes or are pre-diabetic hope to stop medication in future by making suitable lifestyle changes. Is diabetes reversible, or do people have to take medications lifelong?
Now the trend is many people are talking about the diabetes reversal programs. It is a dream of every diabetic patient that to stop their drugs and to lead a normal life in the near future. But the problem is diabetes is an ongoing process, and at the point of diagnosis of type 2 diabetes mellitus, about 50% of the pancreatic function has already been lost. So diabetes is not completely reversible, but it is reversible to some extent. Patients can go into remission or they can become near normal, but they will not be normal. So they may need medications in the near future. Maybe they can go into remission for 1 or 2 years, but it is possible only with a strict diet and exercise plan. If they relax the diet even a bit, even for 2 days, again the sugar levels will start to rise again. So they should always have a check on the sugar levels, as the process is not completely reversible. And this diabetes reversibility is possible only with type 2 diabetes mellitus patients. In type 1 diabetes, there is absolute insulin deficiency. So any patient with the type 1 diabetes should not be dodged by this reversibility program, and they should not go behind it. They should continue their insulin, and they should not stop their insulin doses. When they stop their insulin doses, they can go into a serious complication called diabetic ketoacidosis. That is possible in type 1 diabetes mellitus.
Dr. Sadana, does hypertension increase the risk of heart disease or heart attack in individuals? What can be done to manage hypertension, thereby reducing the risk of a heart attack?
Yeah, definitely this hypertension and diabetes both are closely linked to the development of cardiovascular diseases. To control hypertension, there are 2 important things we have to remember. First thing is regular checkup, low salt intake. That is very, very important. You should not take added salt. And the other important thing is exercise. You have to maintain proper body weight. Third thing is, very important, is use of drugs as prescribed by the doctor, your consulting physician. So lifestyle intervention plus the drug therapy, both of these are important. And another thing I forgot is that is smoking. Smoking should be curtailed at any cost, and alcohol intake should be reduced to less than 1 drink per day in a female if patient is already taking, and less than 2 drinks per day in a male. But if patient is not taking alcohol, you should not advise him to start taking alcohol. So these are the various lifestyle intervention and drug therapy to control hypertension, which will reduce the effect of hypertension on cardiovascular diseases also.
Dr. Suri, are complications of all types of diabetes, are they the same, or is there a variation in the severity of complications?
Yeah, diabetes complications are definitely there, and that's why we treat diabetes. Complications can be of 2 types. acute complications and chronic complications. And acute complications are like diabetic ketoacidosis, hyperosmolar state, hypoglycemia. Chronic complications are micro and macrovascular complications like neuropathy, retinopathy, nephropathy. These are microvascular complications, whereas macrovascular complications like coronary artery disease, stroke, peripheral artery disease. But most of the time they are combined together, and there is hardly any difference, and many times patients, they do present with combination of both micro and macrovascular complications. In type 1 diabetic patients, it is the duration of diabetes that matter. In type 2 diabetic patient, right at the time of diagnosis, these people around 30% patients, they do have these type of complications right at the time of diagnosis. It's the duration of diabetes that matters, and the glycemic control that also matters, and other comorbid issues like hypertension, dyslipidemia, obesity, that also matters.
Dr. Santan, which diabetes complications are common in elder people with diabetes? Can you give some tips to manage such complications in the elderly?
In elderly diabetics, the complications that can occur are diabetic kidney disease. It is mainly due to the longer duration of diabetic in elderly, so they can go on to develop a diabetic kidney disease. So how do we diagnose this diabetic kidney disease? It is from the serum creatinine level, blood creatinine levels, and we can check for protein loss in the urine. Normally only 30 milligrams of protein can be excreted in urine per day. So when this protein is excreted in more amounts per day, that is an indicator of kidney disease. So what is the problem with kidney disease? So the problem with kidney disease is they can develop volume overload, and they can develop breathlessness and leading on to heart failures. These are the problems that can occur due to kidney disease. And the next one is hypoglycemia. That is again common in the elderly. The reason being, after 50 years of age, with every year, there is a 1% decline in the renal function. Slowly, as somebody is 70-year-old, he has 20 to 30% loss of his kidney function. And what happens is the drug metabolism does not occur like the healthy individuals. So the drug stays in his blood for a longer time, and they tend to get hypoglycemia or low sugars. So how to prevent hypoglycemia? They have to take a small snack between 2 meals. When the space between 2 meals is more than 5 hours, they should place a small snack in between. For example, when a patient takes his breakfast at 8:30 or 9 o'clock in the morning, by 11 o'clock he should have a cup of milk and a small amount of 2 biscuits, or he can have half an apple or so at 11 or 11:30 to prevent hypoglycemia. And also, as in elderly, we should be very careful in giving diabetic medications. We should not start with a higher dose and always start with a lower dose in diabetic elderlies.
Okay, Dr. Sadana, having a silent heart attack puts you at a greater risk of having another heart attack, which could be deadly. Why do people with diabetes experience silent heart attacks? Because that is the most riskiest.
Because there are a lot of, you can say, atypical symptoms or silent symptoms. You can say patient might be having a heart attack without any symptoms. And this is especially common in patients who are elderly and diabetic especially. Reason because in diabetes there is a phenomena called autonomic neuropathy. That is, there are some nerves which supply the pain receptors which are already damaged in diabetic patients. Because of this, the perception of pain is not there in those patients, and patient can have a full frank heart attack without any symptoms. So atypical symptoms should also be looked into, like mild sweating, some breathing difficulty, or some acid peptic symptoms. Patient of a diabetes should not ignore these symptoms and immediately consult a doctor. This might be a indirect, or you can say a silent part of heart attack also.
Okay, thank you so much, doctors, for speaking to us and sharing all these very important, points which people need to keep in mind. And most importantly, I think what you said, to avoid, not to overlook any symptom. Of course, manage diabetes holistically, manage it well, whether it's through your diet as well as with the right kind of drugs. Thank you all so much for joining, and thanks so much for watching.